What I want to do here before we part ways is come back to the 30,000 foot view of what we've talked about, which is to maintain cardiovascular health, we want to control our metabolic health. And to do that, we want to regulate our carbs, which is going to control blood glucose and insulin. But let's get into more detail what that would include. Somebody, again, relatively healthy now. They've listened to this point and taken a lot of information in, but they want to do the 80-20 when it comes to prevention and taking care of their cardiovascular health. Other than the lower carb, controlling blood glucose, controlling insulin, and again, the thesis of metabolic health within all of this, what other pillars should they look at?
You know, the way you phrased this question, Jesse, reminds me of something that I probably should have brought up a minute ago. Get a CGM, continuous glucose monitor, and eat to the glucometer. And then once you find out what foods may tweak you, and also don't say, okay, that peak only went to 120, so I'm fine. A lot of people, that's why we get insulin response. A lot of people get really high insulin responses, but they're still keeping their blood sugars low. So get a CGM. Even in early 40s, I would clearly get one of those. There's no question. And if you want to use one of the prescription level ones, I'll be happy to write the script for you. I feel very strongly about people doing that. You have to pay for it. Insurance is not going to pay for you because they want to wait until you get really, really sick and diabetic before they will. But get get a continuous glucose monitor.
Okay, diet aside, now we have the pillar of, again, maintaining blood glucose.
Mm-hmm.
CGM is a good way to look at what's happening there.
Mm-hmm.
What about fasting? We've talked about exercise, but let's bring fasting into it. And then other big pillars that contribute to metabolic health.
So really good point. You know, the big three are diet, exercise, and sleep. Then you get into things like environment. Now, I saw your interview with Robert Lustig about a year ago, right after you did it. He came on with me a few months later, and he had just published a great article where he was talking about the 4 types of obesity. The bank account, calories in, calories out. What you and I tend to focus on more on, carbohydrate insulin model. The oxidative model, which gets more into my space, more high-tech, deeper medical evaluation of inflammation. But then the fourth one was obesogens. The environment really is, there are some obesogens out there, and they're right there in a lot of people's homes, like black plastics and phthalates and things that people use to make it easier to wash their frying pans. So there's a lot of that. So be aware of the ways that you can get into this problem. Go back to the basics. I'm sorry. You asked about fasting. Let me give you a vignette about that. A lot of people come to me and have, as I mentioned before, have already lost 30, 35 pounds, and I always ask them how they did it. Almost all of them will say the same thing. Well, the first thing I did was I cut carbs. The second thing I did was intermittent fasting. And, technically intermittent fasting just means closing your eating window. And it's preferable to do it for dinner, for supper, the last meal of the day. Almost everybody does it for breakfast just because we're humans. And then they'll ask, well, what do you think is the next step? And I always ask, well, have you ever done prolonged fasting, 24 hours or more? Oh, no, I'm not going to go there. We have a lot of people that do it, but for every person that does prolonged fasting, there's probably 100, maybe 200 that'll do intermittent. But prolonged fasting is a great way to reset your metabolism. As we mentioned before, so pillar number one is diet. Pillar number two is exercise. As we mentioned before, it's not just going out and jogging like my generation learned 50 years ago. In fact, high intensity, there's been crossover study designs, head-to-head comparison, every age group, 30-something, 50-something, and 80-something people. And for every group, high-intensity interval work was far better at dealing with metabolic disease than anything else. A relatively close second was resistance training. A distant third was aerobics. So consider that as you're building your exercise program. Also consider what the weightlifters know. Your legs are going to change your metabolism, not your arms. So then you get into sleep. If you haven't read the book by Walter, I'm blanking on his name, Why We Sleep. Have you heard of that book?
Matthew Walker?
Matthew Walker. Yeah, you're right. If you haven't read that, you should. And, the greatest quote in there is in the intro where, hey, if you can go to sleep listening to this book or reading it, more power to you. I've accomplished my work. Sleep is critical, especially for boomers, guys my age, and especially for folks with prediabetes. It starts with basic sleep hygiene, and then it goes beyond. I've got a long story about my own sleep. It's a battle. Once you get beyond sleep, then again, we talked about environment, and we're talking about Robert Lustig and obesogens. Then stress and relationships. Relationships are, I can't remember his name, one of the recent Surgeon Generals wrote a book about how, this is like becoming the lonely generation. We do need to have an acknowledgement for mental health. Stress is very much related to cortisol. And as you know, cortisol drives metabolic disease. So those are some of the things that we need to be thinking about. You noticed medications have not made it into the list yet. They're this far down, 8 and 9. Supplements, the same thing. They're clearly evidence they can work, they can help in certain situations, especially when you get my age and, you're fighting that uphill battle. But it's the other stuff first. And the other thing you'll notice is that stents and bypass grafts didn't make it into the cut.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
I started as an ER doc. I love doing emergency work, but most of these things coming into the ER should have never happened. High levels of glucose or even high levels of insulin irritate that